both of you that made me realize that something very real and tangible was happening through social media. These physicians were sharing their knowledge, sharing information, but up front and upstream from that, they were listening and actively engaging with us patients, as well as the other stakeholders who are on this chat, and on others, because when Anne gives her introduction, she'll tell you about hers. Anyway, so the reason we're here today is to talk about that aspect of things, and I'll let you now both introduce yourselves.
Good morning. I'm Ann Becker-Schutte. I'm a psychologist in private practice from Kansas City, probably better known at the moment as Dr. Becker-Schutte on Twitter, or the most talkative girl at MedX.
I think that there's several contenders in that prize.
She's still leading the way.
She's still leading.
Apparently, yeah. Which is not in my real life. People back home would be shocked. I'm pretty quiet out there and on Twitter land. I have a practice that focuses on working with patients and caregivers that are affected by serious illness. That's the therapy work that I do. I'm just a one-person shop. And so back at the beginning, when I was still in sticker shock over all of the many things I didn't know about being in business, because they don't teach you that stuff in psychology grad school, people told me, you've got to get a website, you've got to write a blog, you've got to be on social media. I was incredibly skeptical of the social media piece of that. I could understand the blog, that's education, that makes complete sense. The social media piece looked completely frivolous and useless to me. But we'll get into a little bit of that more after Deanna introduces herself.
My name is Deanna Tai. I'm a breast surgeon. I'm in solo practice in Burbank, so just a little bit south of here, Southern California. I am not affiliated with an academic center, although obviously I have an academic background as far as my surgery training. I've been in practice for 18 years, and probably for the last 15 of those have had a website, which I thought was enough to sort of put my stamp out there, put my brand out there, and kind of fell into social media by accident. I never had a Facebook page because I don't have any friends, and I just didn't see the need for that. I mean, I have a few, but you know, if I needed to talk to them, we call each other, or email, or text, or something. I just didn't see the value to me as an individual on Facebook. And then you start hearing about all these, as a doctor, should you friend your patients on Facebook and blah, blah, blah. I am currently on the executive committee for the American Society of Breast Surgeons, and I still am chair of the communications committee. And a few years ago, before I was on the board, as chair of the communications committee, we were looking as an organization, the American Society of Breast Surgeons, to get involved in social media. We realized ASCO has a presence, a lot of the big medical organizations have a presence, and we wanted to be able to reach out to our members who are physicians, but also the patients of our members, to allow them to find us, to give them an idea of what our mission was. So I had to go before the board and discuss why we need to get involved in social media, and I didn't have a Facebook page or a Twitter account or anything. So I developed them, and I set up a Facebook page as a business page in my practice, but then just got on Twitter. And like you said, basically just started listening, because I didn't really know where my voice was or how I fit in. And you just listen enough, and then you figure out when it's time to butt in. And that's kind of what I did.
I just realized I think I need to add that I'm a 3-time breast cancer survivor. So I don't know if I mentioned that in the introduction, but I'm, a patient. So that's why this is so interesting to have this conversation. Well, let's get started. My mind's going blank because just thinking of everything. Well, why don't you start by, if you can think of an example of an interaction with a patient who may or may not have been a patient of yours on social media that created an aha moment for you, or something like that?
My first aha moment probably came during the breast cancer social media chat. I began engaging on Twitter right about the same time that the chat was getting started. I mean, we kind of have the same Twitter birthday. You know, I had participated a little bit in the healthcare and social media chat on Sunday nights, which is huge and overwhelming. But it did kind of hook me on the idea of a conversation in a community being possible on Twitter. And then I found the breast cancer group, and at the beginning, that was still small enough that the conversations were not as overwhelming for someone as new to Twitter as I was. And we were talking about one of my areas that I'm passionate about, and so I started just showing up there. And, you know, the theme that keeps coming up over and over and over throughout this conference is stories, but I'm always in it for the relationships. You know, and as soon as I had people saying hi to me that, you know, we're talking about that day, or, you know, there was this sense of connection and caring that was clearly communicated, even in 140 characters. That's what hooked me.
For me, it was, I think I got on Twitter, BCSM started July 4th, 2011, so it was a couple months before that. And I still, you know, again, I started listening, I started following. I still remember the day when Jody and Alicia followed me back. I was like, oh my God, Steels and Jody MS followed me back. But my aha moment was when I was online late. It was at the end of the day. I don't tweet normally during the day. I mean, it's either early morning or end of the day. Those are surgeon's hours. And I came across two women who were having a conversation about a friend of theirs who had been diagnosed with Paget's disease, which is an unusual breast condition that may or may not be associated with breast cancer. And they were talking to each other, and one said, well, my friend's doctor recommended a mastectomy, and the other one said, well, should she get an MRI? And they were kind of going back and forth, and I'm watching this. One just waiting for the point to butt in, but the other is realizing how many patients out there are not getting the information that they need from their doctors. And so I, as I am known to do, just butted in, and I said, you know what, I'm a breast surgeon. Can I give you any suggestions or anything like that? And so the woman whose friend was that was going through this issue DM'd me. I gave her my email, and I said, you know, I can't go through her pathology report and this, that, and the other, but if she's been diagnosed with Paget's disease, this is the algorithm. What city are you located in? What's your zip code? I pulled up a couple of American Society of Breast Surgeon members that I know. I said, here's a couple people she can go to for a second opinion. Got an email about a month and a half later. She had the MRI. It was very localized. She had a lumpectomy. She's doing great. Thank you so much. And that, for me, was that's sort of when I realized that's where my voice is. When I can actually reach out to someone, and in my mind, this is no different than if I have a colleague or a friend across the country and they call me and said, my mother was just diagnosed with breast cancer. What should I do? I'm doing the same thing that I do every single day, not giving specific medical advice, but giving guidance and giving support. And to then get that feedback was just priceless.
Deanna, can you say a little bit more about that? Because that's exactly the point. So many physicians talk about being afraid or, you know, being discouraged or not being allowed by their organizations to go on social media and engage with patients because, you know, of course, HIPAA and privacy and the fear of, well, I can't give medical advice, so what use would I be? So say a little bit more about how that, what you said about if a colleague were to contact you, because it's exactly that.
Yeah, I mean, so there's two things. One is I'm very fortunate that I am in solo private practice. And while I am speaking for myself, and obviously I want to represent my brand well, I'm also speaking for the American Society of Breast Surgeons, and I'm also representing BCSM. But in terms of, I mean, again, I'm not giving specific advice. I get a lot of DMs and a lot of direct tweets from patients. I've been diagnosed with this. first thing that I'll usually do is follow them and tell them to follow me back so we can do this in a little private setting. And there are some people that I've given my email out to so we can have a little bit more extensive discussion. But again, it's, as physicians, we get these calls all the time. A neighbor, a friend, a family member, a colleague across the country in a different specialty. My so-and-so was just diagnosed with breast cancer. What do I need to do? Because this is outside my area of expertise. Same exact thing is what we're doing here. And I don't think that crosses, I don't think that conflicts with HIPAA. I don't think it crosses any professional boundaries. As physicians, we want to share our knowledge. We're educators. This is what we're trained to do. And why not, there's only so much you can do one-on-one. Why not be able to disseminate that a little bit further?
Right, and one of the things that I've heard listening a lot, in fact, in the opening session, you heard Michael Saris say, I went to Dr. Google. People are there online, and I'm always a little frustrated when I hear health professionals, whether it's mental or medical, say, I don't want my patients to go online. And I think, come on. Everyone's going online. This is what we do. This is how we interact now. And so it's not that we want to keep people offline. We want to put good information online. And part of that is by having genuine people online. I'm not an organization. Anything that I write on my blog is written by me out of my brain. It's not canned, it's not produced. And you know what? My clients love that. Other mental health folks have access to that. If people are going to Dr. Google, let's make sure there's good stuff for them to find. Let's not try and fight the ocean.
And Anne, why don't you tell us a little bit more about being a mental health professional and using social media, and there's so much stigma around mental health and so much ignorance. Tell us a bit more.
Well, how many hours do we have? No, actually, it's a big deal. Mental health providers are especially wary of online spaces because so much of our work is about confidentiality. HIPAA is the tip of the iceberg to what confidentiality is to us. Without that secure privacy, we have nothing to work with. And so a lot of mental health folks look at online and think, oh, that is not private. And I would say, right, but you're not doing therapy on Twitter. You're doing education on Twitter, and education should be public, not private. And that's the difference. And that's the switch that I think a lot of mental health providers struggle a little bit with, is that when you're interacting online, you're wearing your educator hat. That's the time to teach and supervise and do public health education. And so that's how I reconcile that. And I have a social media policy. My patients sign it on the first day they come into my office at the same time as they hand over their insurance information. And it very clearly says, I am not going to follow you on Twitter or LinkedIn or Facebook. And while you may follow me, that's not private. So you should know that at the get-go. I don't have any control over you. So you get to follow or not follow your call, but it's not private. So if you want total confidentiality about your connection with me, maybe you shouldn't do that. I'm not on social media to get patients.
Exactly. Anything else to say, or should we open it up to questions?
No, the only other thing is just to expand a little bit on Anne's point, is that we're not on this to gain patients. we're educators, we provide support. I feel very strongly that if there's information out there, it should be accurate information. Again, two women should not have to be having a conversation about some obscure breast disease in the middle of the night and figuring out between themselves and Google and whatever, does she need an MRI or does she need a mastectomy? That is a big lack. That's a big fault of us, the docs, that we're not providing that education to our patients. I am thankful that they are at least tuning into an area where they can find some support. My feeling as a physician, part of my responsibility if I'm going to be on Twitter is to help guide those conversations, help steer them in the right direction. And one of the things I'm very proud of what we've been able to accomplish on BCSM is by setting that example and showing how you can interact with patients as a medical professional, we have attracted a whole bunch of breast surgeons, medical oncologists, we have OBGYNs, we have radiation oncologists. We basically have all of the medical specialties, psychology, social work, everything. We're kind of showing them how you can interact with patients in a constructive and productive way, and providing a safe place for them to go for good, credible medical information.
And to add to the point about you're not on Twitter to try and get patients, I think I can speak for my fellow patients in that we pick that tone up right away. It's very clear. You sniff it out a mile away. And if someone is interested in having a genuine interaction and said, a genuine relationship, it's possible when you find the people who are on there authentically and who have awareness about what they're doing. So it's very constructive. We have a question from Emily Bradley.
I have a two-part question that goes into two aspects. As breast cancer, you're involved with the breast cancer community as a breast surgeon and as a mental health professional. I know there's stigma and a lot of misconceptions in both of those fields, and I'm sure they overlap. And one of the things that I've seen, and I'm not a part of that community, so I'm not making any assumptions, but I've seen in my opinion, poorly designed advocacy surrounding about certain body parts instead of the person and the disease. And with mental health, I'm trying to be, but as mental health professionals who, you focus on that aspect, but then the advocacy coming together, how do you fight that stigma online, and do you see it a lot in your community, in your discussions, and how do you handle that?
I think I can clearly say that in the community online, we certainly talk about the inappropriate marketing of illness, and it's handled and discussed. And we talk about the fact that anyone who is struggling is not a commodity, and their pain is not a commodity, and we just call that out. I would say there's particularly in the BCSM community, but I hope that in my presence online too, there's a zero tolerance for things that are damaging. If we see it, we call it out, and it fades away very quickly.
Nothing like a little public shaming sometimes. No, I mean, one of the things that comes up a lot in the breast cancer community, BCSM community, especially, we're coming up on October, so it's Breast Cancer Awareness Month, that since when did my disease become an excuse to go shopping? So we address those issues. We have constructive discussions around those issues. But I agree with Ann, the community polices itself very well. The patients, the advocates that are on BCSM, especially those that have been on for a long time, are very good at calling out spammers, calling out companies that are making inaccurate marketing claims like, if we can find that you're at risk for breast cancer, we can prevent it. Well, that's not actually true, because you all know we don't have true prevention. I am very vocal at calling out those companies because I know a lot of them. because I work with a lot of them. There was one in particular where I had had a conversation a couple weeks earlier with their marketing department. They wanted to put some brochures in my office, and I said, no, unless you start taking that language out of your publications and off your website, I cannot, I believe in your test, I have the kits in my office, but I'm not going to put your literature there. They started following me on Twitter, and then they started saying the same BS on Twitter, and I called them out. I'm like, you know, you guys should have known from our conversation a couple weeks ago, I'm not shy about this. But the community does a really good job, and I think that's, if you build a really passionate community focused on the right things, they will police themselves. And like Ann said, there's a zero tolerance for anything like that.
Any more questions from the audience? I have a mic. Let's bring it.
It sounds like that all of you use Twitter very much, and what I'm still trying to find out is how to make Twitter more accessible for individuals with disabilities. The patient population that I represent is young stroke survivors and brain injury, and the parts of the using it on a handheld device, the speed of the stream, that while you're thinking of something, other things of your followers are coming in. Do you know of any resource? So we're out on Facebook because we can group the conversations a little bit better. It's a little bit slower paced and not quite so overwhelming. But when you combine slower processing speed, visual deficits, one-handed typing problems.
Well, and I think that is an excellent illustration of the fact that there's multiple tools, because not every tool is the best fit for every population.
But if all the physicians are on Twitter,
I don't,
They're not all on
trust me,
Twitter.
they're not all on Twitter.
well, but see, we're not on our Facebook either.
But maybe you invite them. I would say, you know, if you know of some really great patient-centered physicians that are specialists in brain injury, you invite them. You say, hey, could you check out how some of these other physicians are serving as a community moderator for their disease condition? And you can see, you know, they're not being taken advantage of. Give them a call. Deanna would talk to another physician.
Absolutely.
Invite them. Yeah. Sure. Absolutely. You know, this doesn't, the deal here, our entire, the mantra all weekend has been, let's participate, you know, let's communicate. Okay, that's two ways.
Yes.
That's two ways. You know, providers are scared of HIPAA, of liability, of lawsuits. They're scared of those things. And incidentally, those things can ruin my life. So there's a good reason they're scared. And, you know, and they should be as well. Like, we need to be held accountable. I'm not for a moment suggesting otherwise. But they are scared, and so they may need an invitation and some encouragement to show up.
I think one thing that's a huge
Liza, there's a
takeaway
question
for me from our interactions, what I've seen with BCSM and other communities with doctors like both of you, and our interactions here at MedX, is that we as patients, as e-patients, and this sounds trite, but really think about it for a second. We are people. Doctors are people. And we must never forget that.
One of the chats that we had a while back was from the patient side, what do you want from your doctor? And there were all these things, instant access, and I want my phone call answered in 2 minutes, and there were a bunch of us docs, and we were given, I think, only about 5 to 7 minutes at the end. But we basically said, when I have that interaction with you in my office, it's one-on-one, and my job is to make you feel like I have no other patients. But the reality is I might have 20 breast cancer patients just like you that all need an hour of my undivided attention. And I make a point when my patients are in for the first consultation, and we're sitting in my consultation room with the door closed. My phone doesn't ring in my office. I don't have the ringer on in my office. I make a point of when we're done, call at any time, but just like you saw, we were not interrupted for this full hour. I will not be interrupted or pulled out of a patient room for your phone call. I return my phone calls right before lunch, right after lunch, sometimes at the end of the day. Sometimes at the end of the day, that's 6 or 7 at night. And my interactions with Twitter are the same. But I think it's letting, and there were a couple of us docs that sort of started getting that point across. And the patients in the group were like, oh, I forgot I was not the only patient. That's great. We're doing our jobs then. But that's something that we've tried to get across as well, is that we are really trying our best. But I'm in solo private practice. There's only one of me. And I'm the only one that can answer these calls. My medical assistant can't. If I had a nurse, she can't take these calls. It's all got to go to me.
Well, and let's not assume that doctors aren't patients, please.
Thank you.
Because, doctors also, have a patient experience and want the same things that, we've been hearing all weekend that ePatients want. So this is not, it's not a dichotomy.
Yeah, and to add to that, if you just think about from the patient perspective what we go through in our professional lives about, do I disclose, can I disclose, what do I do about that? Imagine doctors having to go through that dilemma. Food for thought. Alicia, a question.
I'm actually just sort of watching the Twitter stream. Oh, sorry.
So you're not paying attention?
Yeah, no, I'm not. Anyways, one of the questions that keeps coming back just through the stream today is, this is great that we're all here like live tweeting and sort of, making these connections in a virtual social media kind of sense. What happens to the percentage of patients and population that are not engaged in this fashion? I'm wondering if you can speak to what you've learned in online communications. Has it impacted the way you deal with patients offline? Is that something that you could speak to and just address?
Definitely.
I would say one of the first things, then I'll let Deanna jump in because she's got thoughts, is that I have so many more resources to offer my clients in person now, because I follow really smart people on Twitter, and so I can connect people that I work with individually to things that I didn't know about 2 years ago or 5 years ago or 6 months ago, because I hear about it quickly on social media. So it makes me a much better clinician because I have more to bring to the table.
The other thing and I think Ann shares this as well, is that I know that the patients get a lot from our participation. I mean, we've been told that, we sense that. But what I don't think the patients realize is how much we as clinicians gain from the interaction with patients. I know I have a very good relationship with the majority of my patients. I know that they tell me, as their surgeon, which usually is the one you least have a relationship with, they tell me a lot that they may not bring up to their medical oncologist or their radiation oncologist. But what I learned from the chats is how much patients put on their makeup and their best suit and their best behavior to come into the office. I know what kind of chemotherapy these women are getting. I'm not following them all through their chemo because they're seeing the med-onc. The med-onc probably doesn't even know as much as what's really going on, but we learn about it from listening to you guys online. And it's given me a much bigger appreciation for what my patients really are going through. And it's changed my approach to the conversation with them. So, how are you doing? Oh, I'm okay. No, really, how are you doing? No, I'm okay. No, really, what is specifically going on with X, Y, and Z? Because there is no way, I know what drugs you're getting, there's no way you're doing okay. That's a level of questioning that I wasn't aware of, or didn't know enough to probe deeper. And that's one of the things that I get from participating with these kinds of groups.
Oh, sorry, Emily, just to add to this, there's a reason this panel is about synergy, because you're being aware of that. You're being able to push gently or fiercely, but with the right intention.
Bed police?
Push that patient gives, if I hadn't had a doctor who hadn't been like that, I don't know what I would have done, because you do feel obligated just by your own sense of dignity and decorum to show up and do what you have to do, and so thank you for that. Emily.
My question is, did you ever have any concerns? Sure. So historically, when you were building BCSM, I guess this is kind of a little bit more for the patients, but was there ever concern that bringing in professionals would change the dynamic of the community, or that the community would feel like it was intrusive in a sense?
Absolutely not. When I first started seeing doctors join in on the conversation, because it's not a conversation. No one is, we aren't giving lectures. We're putting questions out there for the community to answer. So when a doctor comes on and says, I'm part of your community, it's like, I could almost cry. It's like, yes, you are part of my community. I'm part of your community, and this is exactly where I want to go. I mean, I was just like, wow, there's 2, there's 3, there's 4. It was the coolest thing.
That's Jody Shager, the co-founder of BCSM. And to add to that, as an early adopter, participant of BCSM, there was this feeling of it all coming together organically. So it attracted the kinds of doctors who wanted to have the kinds of interactions that were absolutely the opposite of intrusive. It attracted the kinds of patients who also wanted to have those conversations. Researchers, people from hospital administration, all the possible stakeholders you could imagine. And, organically as well, people who didn't fit in or people who didn't have that kind of intention, it just got diluted. Jody, you have a follow-up?
One more question. Yesterday, Deanna said that, at full functioning, we have an interdisciplinary team on that chat. And part of the goal is to not only have the patient perspective, the radiologist perspective, a physical therapist perspective, a dietitian, someone from immunology. How are we going to, improve our immune systems to fight this disease? So we want every person that plays on this healthcare team at some point or another to be part of the conversation, because it's the only way we go forward.
All right, we've got
One more question, but we'll
We've
be
got
all
no
around.
warning.
Hey, Michael, let me bring you the mic. Bring the mic to Mike.
Hi. As you know, I'm a huge advocate of everything you do online and what we do, but one of the things I found with some of the chats that is a big bugbear of mine is that patients suddenly think they can become doctors as well. And for me, there is a red line that no patient should ever try and diagnose or treat another patient. And I just wondered, you're nodding your head, but have you had experience of that happening? Because, I find it's fine to say, look, when I was under that med, this is what happened to me, but I would never dream of saying, up my steroids to 30 milligram. And that's a big line for me that patients shouldn't cross.
Yeah, I mean, there's 2 things. One was, the experience that I relayed earlier as far as stumbling across a conversation where these 2 women are trying to figure it out for themselves. But the community in general is also very careful. And again, it's not only the docs, we will step in. Someone's talking about their horrendous experience with tamoxifen. we make it a point to get across that, you know what, not everyone has a horrendous experience with tamoxifen, and there are very good reasons that we recommend it for extended therapy because it can prolong survival. It's not for everyone, but we do really try and get patients, and it's very difficult to do sometimes, but to get patients to separate their specific side effects or problem from the global issues. And I think that's one of the reasons why not every patient is a good advocate. Because to be a good advocate, you actually have to separate yourself a little bit from your disease and understand all of the factors that are going into your treatment. But that is something that both the patients and the physicians do police, and we try and guide those discussions. It's a really important point.
Well, I think our time's up, unfortunately. So thank you all for coming. And
We'll be here.
we're here. We're here. And on Twitter.
You know where to find us. I may not get back to you for a while because I can't tweet in the OR, but I will get back to you.
My fingers might be broken after minutes.